Hello, and welcome to our broadcast. I'm your host, Beth Schenk, Executive Director of Environmental Stewardship at Providence. As a reminder, the information provided today for this event is for information purposes only. If you have questions around Providence's environmental stewardship programs and practices, please visit providence.org/advocacy. For any medical questions, please reach out to your primary care or health professional. And let's begin. Joining me today, I'm really pleased to have two of our key leaders for environmental stewardship, and that is Ali Santori, Senior Vice President of Government Affairs and Social Responsibility at Providence, and Dr. John Milne, Senior Vice President of Real Estate Strategy and Operations. So welcome to you both. And just a little bit of background about our goal before we get started. In April of this year, Dr. Hockman and Ali Santori and myself announced our goal for Providence to become carbon negative by 2030. This is an enormous goal, and we know it well now, but this is a bold because our commitment to social responsibility is also bold. Our heritage, our values, and our vision for health for a better world compel us to act. So today we're going to hear from these two key leaders that I've mentioned to understand their perspective. So I'd like to start with you both, Ali and John. If you just please tell us about your role in Providence, introduce yourself briefly, and then we'll get into some questions. Thank you. Whoever would like to go first.
I'll defer to Ali on that one. You can go ahead.
Go ahead, Dr. Milne. You can go first.
Oh, wow. Okay. That's different. Thanks, Beth. I really appreciate you having us both here today to talk about, obviously, this important topic. As you mentioned, I'm Dr. John Milne. I'm the Senior Vice President for Real Estate Strategy and Operations for the Providence Health System. And so for those of you who aren't very familiar with Providence, we have 51 hospitals across 8 states and have a wide real estate footprint there. And so as we think about real estate, it is our hospitals, it's our medical office buildings, but it's also a variety of other support type functions that are there as we look at facilities and environmental services, housekeeping type functions that all collectively roll up to that environment. And the reason that's important, obviously, for an organization like us as we think about our environmental footprint is the facilities that we have, really are a big part of that overall carbon footprint as we're going to get into here today. And so excited to be able to help lead that effort on behalf of all of our facilities teams out there who are very engaged with this work, and then looking forward to how we can continue to partner across all of our regions to be able to really lead this important effort. Ali?
Yeah, thanks, Dr. Milne. So, you mentioned that this is a true partnership, and I have the privilege of serving as the leader for our government affairs and advocacy functions across our footprint, so within our states and in Washington, D.C., and also our social responsibility platform. And the executive team at Providence agreed over a year ago that addressing climate change, would be one of the key pillars of our social responsibility platform as an organization. And on our goal, our very exciting industry-leading goal to become carbon negative by 2030. So I lead not only our kind of national voice in advocacy and policy when it comes to climate change, but also helping to coordinate and bring together other leaders like Dr. Milne and others across the organization, because when it comes to addressing climate change, this is more than just about advocacy. It's more than just about our real estate footprint, but it's truly a all hands on deck, multifunctional effort across the entire system, which is not easy. And Beth, you know that firsthand, having to be the on the ground leader for this work.
Thank you both so much. That's really helpful. So you both have mentioned how big of a goal this is, as did I, nation leading, industry leading, and a huge challenge, but especially a huge challenge during a global pandemic. And we might add during a time of some civic unrest. Yet, under your leadership over this past year and before, we have made progress. So, Ali, for you first, what are your top priorities for this work, and what are you most proud of so far?
The thing I'm most proud of is our unwavering commitment to social justice. I think that in these uncertain times, these incredibly difficult times nationally, we find solace in the steadfastness of our mission and our commitment to social justice. And our commitment to addressing climate change goes hand in hand with that commitment to social justice. We take the words of Pope Francis to heart when he called for the protection of our common home, the earth. We believe that health care is inextricably linked to the health of our earth and the health of our climate. So really that cross-organizational deep commitment to social justice is what leads us forward, and is what really grounds us in uncertain times. So that's what I'm most proud of. In terms of our priorities, the first priority was getting everyone aligned around this goal, because it is an industry leading, very, very exciting and challenging goal to become carbon negative by 2030. So getting all teams aligned in how we do that, including our IS systems and teams, our nutrition teams, our clinical teams, our real estate facilities and operation teams, getting that alignment, we all agree that this needs to be addressed, but the how we do that and getting that alignment was part of the challenge. So we've been able to do that. And the other thing, the big step forward that we've done is around data and measurement. So through the platform that we have, the data technology platform that we've deployed across Providence, actually several years ago, we're able to understand the baseline of where we are and where we need to go facility by facility to get to that carbon negative goal. So having that foundation in data and measurement is really important.
Terrific. And that's a lot to be proud of, because across, as Dr. Milne said, 51 hospitals and over 1,000 clinics, it's a tremendous amount of data. So Allie, to stay with you for a moment, if you had to describe in a nutshell, so that's what I'm asking you to do, describe in a nutshell, why is Providence taking this on?
Yeah, I mean, that's a great question. We certainly have our work cut out for us on the front lines of the pandemic. But again, we don't separate the health of our climate from the health of our communities. So we believe that we have a moral imperative aligned with our Catholic social teaching to address climate change. It's part of who we are, to look at whole person, the health of the entire community. Especially we have, as an organization, a very strong commitment to health equity. We know that the impacts of climate change are disproportionately felt and impacted in communities of color and immigrant communities. So for who we are as an organization, our commitment is health for a better world. That includes the health of all populations, improving the health of all populations, and improving the health of our world and our home and where we live. So that's why we've taken this on. I mean, for us, it's a no-brainer. Also, we do hard things. We are the Sisters of Providence, the Sisters of St. Joseph. Their DNA is in our blood as an organization. They took on hard things, and we continue in their tradition.
That's wonderful, and wonderful to hear in days like these. So thank you for your perspective, Allie, especially as our leader in our external voice and in our work with advocacy. And now turning to you, Dr. Milne, for your focus on internal operations, but also as a physician on health. So first, tell us a little bit more about this goal and how we will get there from your perspective.
Well, it's going to, as Allie has mentioned, this really is a partnership, and it is a multidisciplinary process. This is a journey that is not, any one specific group, but it is really going to take, to use the well-worn phrase, a village to be able to do this. And so as we look at this, it's multifactorial, and we think about this from, in my world with facilities, as we think about overall energy utilization and emissions and the carbon emissions that are coming from our heating and cooling systems, as we think about the pieces that are in our ORs with our anesthesia gases and those types of greenhouse emitting gases, our goals to be able to decrease greenhouse gas emissions, to be able to decrease waste that are in our waste streams. This is really looking at fundamentally how we re-engineer the way we do our operations, how we think about our supply chains, where are we sourcing things from, what is the impact, not just directly on carbon, but on the transportation, logistics portions of this, and the impact that will have on overall carbon emissions and greenhouse emissions across this. So it really is rethinking almost every aspect of our business and how we think about that, from how we utilize office space. Do people work remotely like all of us are doing here today? So we're not commuting, we're not having as many cars on the road, we're not using as much real estate, so therefore we're not using as much energy in those spaces. The cascade of opportunities and levers that we have to pull on this are diverse, but no one initiative is going to get us to that goal. Being carbon negative by 2030 is a real stretch for us as an organization. And it is really a testament to Dr. Hockman's leadership of us as an organization that we are leaning into this, as Ali mentioned, a big, hairy problem for us to be able to get there and to really be able to drive that. And it's going to be incredible to see how these teams pull together. And this, I think, will be a catalyst for us as an organization as we come together as a system to really look at how we interact as people of Providence and people of St. Joseph, to be able to understand what it means to really have a positive impact on the world, and how what we do on a daily basis in our operations does have a ripple effect beyond just our individual ministries, our individual communities, the individual patients that we're taking care of.
Thank you. That's really great. And I want to get into some of the health issues, but I first want to just ask you, because your role is unique. You're a physician leader and also one who saw early on, some time ago, that the functioning of our buildings and operations really make a difference. Tell us about that. Why do you think that?
Well, so, as you mentioned, I'm an emergency physician. I still clinically practice at Swedish Issaquah as one of our in one of our regions, and here in the Seattle metro area where I live. And it's a situation where, as you look at the impact that I can have day in and day out at the bedside, touches one life at a time. And you make an impact on your patients one life at a time. But as we think about the broader social determinants of health, as we think about how do we manage populations, how do we really truly bend the curve on health outcomes in all of our communities, it really takes us going upstream to be looking at those broader pieces. And it's something as a physician that I recognized early on in my career through some of my mentors, and being able to look at what are the implications of overall health policy, what are the implications of the broader implications that Ali works on daily, with our state capitals and in Washington D.C. But also then looking at, with our regulatory agencies, it's a broader set of issues that are there. And so for me, recognizing those impacts on my patients when I see them day in and day out in the ER is really that broader cascade, as we think about how things like water quality, how things like global warming, how things like food inequity are able to impact the individual health of people in our communities. It really is a motivating factor to be able to say, how do we get upstream of these problems and really, truly, as a system with our scale, make true difference in this, both locally in our communities as well as nationally, in the leadership role we can serve there, and frankly, across the planet.
Yeah, thank you. And you mentioned the idea of going upstream. It's something I hear from clinicians is that it's frustrating to treat the same diseases day after day, but wanting to affect things through the way Ali works with advocacy and policy. So just to stay with you for a minute, Dr. Melton, about the ways that, can you make a few links for us between climate change, which is what we're really fighting with our carbon negative goal, and health, and why you think, particularly in our 7 or 8 states, that's a big deal?
Well, I think that, probably the most tangible link between direct individual health and climate change, we see this summer with the wildfires across many of our regions, that for many of my patients, when I see them in the ER who have asthma or COPD or other respiratory, chronic type illnesses, that air quality is a huge issue for them. And so being able to look at the predominance of changes in our overall environment and the respiratory quality of the air that we have, the direct impact that has on our patients, and then you start doing the root cause analysis and tracing that back, and it really has a component in global warming and the climate change that's there, and the climate science is fairly direct with regard to that. And I think that as we start looking at looking at all of these types of root cause analysis of why various individuals and populations, whether it be around diabetes or heart disease or cancer or various types of ailments that we are treating on a daily basis within our health system, often have some component that is related to the broader impact on from climate, whether it's how global warming may impact crops and drought and the ability for locally sourced food to be able to impact communities, the affordability of food from that perspective, which then forces individuals who are some of our most poor and vulnerable populations, in these food desert type of situations, to not be able to afford healthy foods, which then leads to diabetes, which then leads to heart disease, and you trace it down. And going back to those core bases, a lot of it is around the health of the planet and the overall impact that we have on our climate.
Thank you. Just another question for you, and then we'll go back to Allie. But I wondered if you could speak a little bit about the intersection of this work and COVID. Now, I know that evidence is still coming in. We are still in the middle of it. We're living through it. But what would you say about that?
So I think it's interesting in terms of as we think about it, just for us locally as well as the broader piece. So obviously, COVID itself, in terms of the development of this virus, is not directly necessarily related to the development or from global warming or other sorts of environmental changes that are there. But certainly the way we've responded to it has had elements to it. It's made us very aware of our supply chains and where we're sourcing products from early on in the pandemic. Getting enough PPE for our caregivers was a huge issue. And as we think about the logistics of our global supply chains, it really has forced us to think about where are our products coming from that we're utilizing, what's the waste stream that we have that's coming away from those with regard to disposables, and looking at how can we be utilizing more renewable and recyclable types of products so that we're not as dependent on those types of disposable goods that then when they aren't there in the supply chain, we now are at a loss for them. So I think there's some complex interactions in terms of how our operations as a system within this pandemic have really been illustrated.
Thank you. And we'll be learning more, I'm sure, as we study, hopefully in retrospect, how after the pandemic is a little more tamed down. But thank you for that. So we've been talking a bit about mitigation through John's leadership, and yet, as Allie said before, we also work on adaptation and building resilience in the communities we serve. So Allie, you mentioned our ongoing commitment to the poor and vulnerable and to people who have more need, who are all more impacted by climate change, by air pollution, by proximity to heavy traffic zones and toxic chemicals, et cetera. So what do you think we can do with this work to help those hardest hit in our communities?
I think, one of the things that I'm most proud of is how we've gotten upstream in terms of our engagement with our community and our investments in the community. Not only do we do as an organization over $1.6 billion in community benefit a year, we also just recently pledged an additional $50 million specifically to address inequities in health delivery and health equity. So those are things I'm incredibly proud of. As this is linked to environmental sustainability efforts, under Beth's leadership, we established the Environmental Justice Collaborative, which is a group of bringing people together for knowledge sharing and looking at how the impacts of climate change disproportionately impact communities of color and vulnerable populations. So that's something that we're doing across our regions right now, which I'm incredibly proud of. We're linking that up with our health equity efforts and our efforts to address health disparity. At the policy level, John alluded to some of our efforts with the state regulatory bodies, and then at the national level, we have been vocal proponents of and vocal advocates on the linkage between climate change and health outcomes. So we've been vocal proponents for national policy related to climate change, including not only restoring a lot of the policies that were enacted under the Obama administration, but even going a step further. So we are one of the founding members of the We Are Still In Pact that commits our organization to the Paris Climate Accord, even as the United States withdrew. We are actually going further than the requirements outlined in the Paris Climate Accord, which is an international agreement. And we do see quite a bit of hope on the horizon on the policy front with the Biden administration coming in. They have a deep commitment to addressing climate change. John was touching on a lot of the areas where you don't think that climate change or impacts, our environment, like supply chain and things like that. What President-elect Biden has done is he has included responsibility for addressing climate in nearly every single one of his cabinet posts. So when he appoints his agricultural secretary, they're going to address climate change and sustainability in our food supply. The U.S. Trade Representative, which is one of the least exciting cabinet posts, President-elect Biden has been clear that they will also be addressing climate change and resiliency within our national supply chain. So it's really exciting to see that commitment at all levels of the administration. And then, of course, you have the dedicated climate czar in former Secretary John Kerry coming in. So we are really looking forward to engaging with the Biden administration moving forward in the year of 2021. And I think that when I think about things to be hopeful around, this is one of the key areas that I find. We are in the midst nationally of a great deal of despair when it comes to the pandemic and the events in our nation's capital earlier this week. And when I look to the future about where we can make an impact and where we can come together to move forward, the area of sustainability is one that comes top of mind.
That's music to all of our ears, Allie, I'm sure. And thank you for that note of optimism. Is there anything that you can tell us, and you may not be able to, about specifically what Providence might be interested in with the Biden administration related to climate work?
I think, right out of the gate, that national leadership, on day one, the president-elect has committed to rejoining the Paris Climate Accord, which is incredibly exciting. I think there's going to be a great deal of time spent in the first 100 days rolling back many of the harmful regulations that the Trump administration put forward related to climate. So there were over 200 environmental protection regulations that were rolled back within the last 4 years. So what we have to do is make up for the progress that we've lost in the last 4 years. I think that will be the initial focus of the administration, and then start to move forward. When it comes to things like a Green New Deal or some of these sweeping policies that have been talked about within the Democratic Party, even with majority control of the Senate that the Democrats now have, I don't think that that's possible. But on the regulatory front, when it comes to how public lands are regulated, how nuclear power plants are regulated, how our transportation vehicles are regulated, there's tremendous opportunity to move forward, even just within the executive authority of the president.
Wonderful. Thank you. John, I want to go back to operations a little bit, though would be interested in any of your reflections about also our external work that you've been involved with. But I wanted to ask more about this connection between environmental stewardship and efficiency, both in our strategic planning. You are a visionary, as is Allie, and you've been able to see down the road a ways as to how we might get there, plan for it, and also afford it. Do you have any comments about that?
Well, I think, the affordability one is top of mind for us. And so, we're keenly aware we are a nonprofit healthcare system, which means that, really our shareholders effectively are the communities that we operate in. And, that community benefit and how do we return value back to our communities is in top of mind really of everything that we do. And so recognizing that money that we spend away from the bedside, away from things that directly impact the delivery of care in our organization, need to be put a great deal of scrutiny on. And so, with this, as we've talked about earlier, it's pretty clear that the impact to our communities of climate change and environmental stewardship is huge. And for us to be able to walk the walk, so to speak, with this, as we look at our ongoing operations, is a critical part of the ongoing process for us. And so we're working on what our 10-year capital plan needs to look like to be able to get us there, to make sure that we've got the investments. But the good thing about investing in energy efficiency is that it has direct payback. As we put money into programs that look at high efficiency boilers, as we look at our HVAC systems in terms of air handling and being able to do automated controls that cycle those types of systems on and off at appropriate times to be able to conserve energy, as we look at strategies about how we purchase energy, where is it coming from, what is the impact with that. It saves money for us as an organization that then allows us to effectively develop a green revolving fund, where we're able to take the money that we're saving and reinvest it back into the organization, reinvest it back into lowering our overall carbon footprint, which then has, as we've talked about, the downstream effect of impacting the health of the communities that we operate in. So we see this investment not in a silo. This is not just simply investing money to reduce our carbon footprint because it's a great political point, which it is, not to discount what Allie's working on there and taking this message to DC, but it really is about how do we really truly live it ourselves as an organization and be able to not just buy carbon offsets or, kind of write a check to be able to, in name, be able to get to carbon negative, but how do we actually really take our facilities as we think about all of the ways that we impact greenhouse gas emission and all the ways that we impact energy utilization and waste streams and water quality and all of those elements that are there. It really all laces together in a way that we're able to actually decrease our true carbon footprint as well as impacting the broader ecosystem beyond us.
That's wonderful. And when you talk about that and how it's integrated in the operations and the care, I think of so many caregivers. So for those of you not in Providence, we call our employees caregivers. So many caregivers who have talked with me, I'm sure they've talked with both of you about their angst about this. And, we live it. Any of us in the West who have endured the fires or who have watched these environmental impacts, we know how important this is, important for the future of the planet, I suppose, the future of humanity, the future of our children and grandchildren. So this is another way I think that your all's leadership really feeds back to build and strengthen the organization. So thank you both for that. In fact, thank you both for being the inspiring leaders that you are. Having been someone in the trenches and doing this work for a while, it is a breath of fresh air. And I just really thank you. And I can say that for the team of people that I work with. So again, thank you. We are getting very close. I would really like to hear this from both of you, and it's a little bit of a personal question. And it is, why is this personally meaningful to you? You've talked about your commitments in your professional lives, which are astounding and impressive and meaningful to all of us and to the world. But what about you personally in just in your background or your life? Why do you care about this work, environmental stewardship?
Well, I think.
Go ahead.
Okay. All right. So I guess so my undergraduate degree is in biology, and so I started learning what the natural environment is and what the ecosystems look like, and the impact that can have there is certainly something that became very aware of and relevant for me early on in my personal life, long before I made a decision to go into medicine. But as we think about our own personal families, I have two kids, and with the legacy that I leave behind for them is an important piece to it. And so being able to look at this broader set of issues and to be able to have an impact and truly have the platform that Providence is able to give us to be able to have that impact, far beyond just the immediate of, personal recycling or doing, all of the things that we all do in our own homes. This is allowing us to do all of that at scale. And for me, that is the exciting part of this work, is that because of the commitment of Providence to this, as we collectively come together, it's being able to have that impact far beyond each one of us as an individual.
Thank you.
Yeah, and that was very well said. And I'll just quickly add to this. Not only is this personally important to both of us, and our children, but as an organization, it's personal for us. We saw hundreds of our caregivers lose their homes in the wildfires over the course of 2020, while also fighting on the front lines of the pandemic. We have a responsibility to step forward and address this at scale. It's easy to say, but it's hard to do. But we've never shied away from a challenge as an organization. And like I said, it's in our DNA, and we have a responsibility to help advance the health of our communities and protect our caregivers from the loss that they experienced over the course of the last year.
Well, thank you both for that additional question. And our time is up. And I thank both Allie and John for joining us today, and to everyone for listening. And to learn more about our initiatives, programs, and services, again, please visit providence.org. Make sure to follow us on social media at Providence Health System on all of these platforms, LinkedIn, Facebook, Instagram, and under @Providence on Twitter. Thank you all so much.
Thank you.
Thank you.